let's just take out a minute to think and look around us. Do you know anyone who has a chronic condition? Family, friend? I'm quite certain that you know someone who has a chronic ailment. And that is how widespread chronic ailments are. They are all around us. And we cannot run away from the fact that chronic ailments exist. And this is why I will be taking out time to dwell on the series called Coping with Chronic Conditions. The objectives of the series is to help you or anyone around you navigate chronic conditions so that they do not affect your mental health. So I'm going to be having different aspects for different episodes of the series, and I'll be starting with today. And today we're going to be talking about what chronic ailments are, what makes an ailment chronic, and how do they affect your mental health. And afterwards, we're going to be talking about ways you can manage them through until we are done, and I'm satisfied that you were equipped with the right information to prevent chronic conditions from messing with your mental health. Hi guys, my name is Paula and this is Paula's Health Tricks. Do not forget to subscribe and hit the bell button so that you do not miss out on new videos. I know you know that chronic conditions include conditions such as hypertension, diabetes, cancer, and asthma. Chronic conditions swallow a huge chunk of every nation's healthcare cost, and they are the leading cause of disabilities worldwide. I can also guess that you know that conditions such as hypertension, diabetes, asthma, and cancer are chronic conditions. But do you know why they are called chronic conditions? Well, chronic conditions are conditions that last over a year and require management, ongoing management, or they limit your activities, or both. How do chronic conditions affect your mental health? So there's a video up on this channel that talks about lifelong medical conditions. I will link it up somewhere here or here so that you get to watch the video and follow. Chronic conditions are mostly precipitated by lifestyle choices, yes, such as tobacco use, excessive alcohol drinking, physical inactivity, poor nutrition. So to the question again, how do chronic conditions affect your mental health? Let's go back in time to the day when you or this person you know got the news that they have this chronic condition. For instance, a parent, a sibling, or you being diagnosed with something, let's say hypertension, it's usually pain laden, it's usually that of discomfort, it is that of worry, it is that of fear, worry about how the treatment plan is going to be, worrying about integrating the treatment plan into the lifestyle, worry about availability of the treatment plans, affordability of the treatment plan, worry about the future. For some people, as soon as they are informed about this medical conditions, they start thinking about when they will die, if they will survive it, and all of that. Many people are worried about the impacts of these conditions on their mental health, and a lot of things come into play. There is emotional pain, and some chronic ailments and chronic conditions actually come with physical pain. So you get to even feel pain physically in addition to the emotional pain or trauma that the news or the ongoing medical condition brings to you. So it is usually never pleasant, and it is something that a lot of people try to shy away from, and it's something that needs to be addressed continuously, renewed, and readdressed from time to time. And that is why I have opted to do this series on this channel. Now, when this happens and the feeling of sadness or pain is protracted and goes beyond 2 weeks or more, there's a tendency that depression can set in. And as we all know, depression would affect the way that you carry on your daily life. When I talked about how I navigated my postpartum depression, I talked about some days when I would wake up but would not want to get out of bed. I wouldn't want to take my bath. I wouldn't want to eat nothing. I wouldn't want to look at anyone. I wouldn't want to interact with anyone. So depression takes you away from reality. It keeps you in a cloud, in a cocoon, in a nest, and it doesn't let you tap into reality to be able to do the right thing. Also, people who have children that have chronic ailments tend to struggle a bit because these children are also affected by these chronic conditions. These chronic conditions have the ability to challenge how the child develops emotionally, physically, and mentally. And this can take a toll on the people who care for them, such as their guardians, their parents, and this can actually be difficult for these people. For instance, a parent can decide to quit. I know someone, a friend of mine, who had to quit her job to stay back and take care of her autistic child. And you know what that means? It means whatever it is that makes her happy at work or however she tries to integrate into the environment, is probably temporarily or permanently gone, and she has to forfeit all of that to face her child. And sometimes it can be very overwhelming. She would break down and cry, and you would see how much pain, emotional pain she's going through. And then looking at the child, the stages of development, and seeing clearly that a lot of developmental milestones that you hoped for are not happening. So it can really take a toll on the persons taking care of these persons who have this chronic condition. Also, the children and the adolescents who have these chronic conditions could feel stressed. They are humans. They could feel frustrated, impatient, and come result to different things like self-harm, not having answers to some questions that they ask, and that is why communication is very important. Age-appropriate communication, age-appropriate disclosure, age-appropriate interactions can help them a lot because the stress from their inability to cope as a result of these chronic conditions can actually bring about adjustment disorders. Going the reverse way, people with depression are at risk of coming down with chronic medical conditions. Yes. For instance, persons who suffer depression are less likely to seek help. Their health and help seeking behavior is low because of the reduced ability or reduced willingness to interact with the others. So they're not going to name what their problem is. They're not going to name the help that they need. They're not going to see the persons who they need to see, such as their doctors, or talk to a therapist or their families. It could even affect their hygiene. They wouldn't want to take personal hygiene seriously because they're probably not bothered about anything physical. They just want to be alone. They just want to talk to themselves and think. They could also resort to drug and alcohol use as a result of depression, wanting to come out of depression through, negative coping mechanisms, and that can actually cause, like we talked about earlier, can precipitate medical conditions that could be chronic. They could eat poorly, in which case they become malnourished. They might not want to engage in exercise, and that also affects and poses as a risk factor in the acquisition of chronic medical conditions. And lastly, scientists have named ways through which depression can result in chronic medical conditions. These are the various reasons why in depressed people, chronic conditions can develop. There is increased inflammation, changes in heart rate and circulation, abnormalities in stress hormone release and uptake, metabolic diseases such as seen in diabetes and all of that. So depression and other mental health issues are linked to chronic medical conditions. And going further into the series, I'm going to be telling you in the next episode how to cope with medical conditions that are chronic in such a way that they do not affect your mental health. Thank you guys for watching. Remember to subscribe to my channel and hit the bell button. I'm going to see you in my next session next week. Bye-bye.